When you're a medical professional and your relative gets sick, the good, the bad, and the ugly. If you haven't watched before, my name is Dr. Nicole Didick. I'm a medical doctor, a geriatrician, so I'm an internist with special training in looking after older adults. Here on The Wrinkle, I try to give you advice that you can use to age well, or to help someone age well. Today I'd like to talk to you about what it's like when you're a medical professional and you have an older relative who's not well. This is something that I've experienced myself recently, and I also hear from a lot of my patients who also happen to be medical professionals or my medical professional colleagues. It's really different to go on a healthcare journey with a family member rather than with a patient. Surprisingly different. I'd like to share what's good about it, but there's also some bad and kind of ugly truths as well. If you're a medical professional, you can probably relate to this, and if you're not, it might surprise you to hear my take on it. So there are some obvious good things about when you have an older relative and you're a medical professional yourself. You can often help to be an interface between your relative and the medical system. You can explain things in terms that you know the relative will understand. You can also often have a more in-depth discussion with some of the providers that are responsible for your relative's care, because they might even be colleagues of yours, or they might just be willing to share things a little differently to someone who works in health as well. So they can maybe tell you things in a way that, you know, they can use the medical jargon or talk in a bit more depth about the plan because they know that you kind of speak the same language. So those can be good things. It can also be helpful because if you've seen medical cases happen before, you have a sense of what the trajectory is going to be and what the needs might be as the person recovers or deteriorates. So you can kind of anticipate maybe some of the changes and guide your relative through that. So those are some very positive things. And I think generally, older relatives are happy when they have a daughter or son who is in healthcare. I hear that all the time, that people feel like they're being taken really good care of because their daughter's a nurse, and so they kind of know what's best. So there is this positive perception, and there's definitely some positive things about it. But there are some things that are not so positive as well. One challenge is mitigating the expectations of the other members of the family. A lot of those expectations are pretty natural. But sometimes they are unrealistic. So for example, getting access to information is something that often other people will assume you can do because you work in healthcare. So if your relative is admitted to the hospital where you work and you have privileges and you kind of know the system, you might even know the doctor, why can't you just look at their hospital chart? Well, as I explained in another video about privacy, there are a lot of legal hurdles to jump through to get to someone's chart. In fact, you can't use your credentials to look at your relative's information. There can be repercussions for that if you do. It could be a privacy breach, and it's just really frowned upon, to say the least. So it can be harder to get information, and that can be difficult when other people assume that you should know things that you don't already know. It could be because of privacy legislation that you just don't have access to that information. Another thing that's challenging is when there's a request to do some advocacy that you sort of know is not in the patient's best interest, not in your family member's best interest, but it's what they want. So they might advocate for an earlier discharge from hospital, or to not have to take a medication, or not have to have a procedure, or not need physiotherapy or something like that, or a certain piece of equipment. And they kind of want you to talk the doctor out of it. That can be, that puts the medical family member in a really hard spot, because you want to do what is what your relative wants. You love them and you've always, tried to do what makes them comfortable and happy. But, if you're doing something that's against their interest in their medical care, that's a real dilemma. It's really hard to balance those things. So that is difficult. I think, again, it's really natural that people would expect that. But it makes the situation really difficult, because if things go wrong, then it's the medical professional family member would feel responsible for the things going wrong. So for example, if they advocate for an earlier discharge and then there's a complication, because it's a natural thing, but it's really hard. I would feel really responsible and I would feel terrible about that. One of the things that I was surprised to find out was just a real feeling of inadequacy when it came to having my family member kind of navigate the healthcare system when they were sick. Working in healthcare where I do, we do spend a lot of time dealing with where our system has gaps. We hear a lot about it from our patients, and we try to help the patients navigate those gaps as best we can. A lot of times we know about what an ideal state could look like and where there's a gap to that ideal state because of oftentimes system issues or other things. In my clinical work, I spend a lot of time giving people advice that's the best advice I can give, and sometimes apologizing for the way the system is. But I sort of know that that's just the way it is, and there's not much I can do as an individual. I'm doing my best for my patient who's sitting in front of me. When my relative was experiencing some of these gaps, I felt personally responsible for them, which is not, obviously, I can't control everything in the healthcare system, but I really felt like I was a sort of an avatar of the healthcare system. I was representing healthcare, and that it was my system that was letting the person down. And at times it was, the places that I worked or the people that I worked with, that they were, not that there was anything that was specific where there was an action or something, but just the way the healthcare system is. I felt like I was responsible for the fact that it didn't always run smoothly, or there were gaps or delays. I really felt responsible for those delays. And I think that there was a perception, that because of my status as a physician, I would be able to cut through some of these delays and make things go more quickly. And a lot of times I just couldn't. I really just couldn't. It wasn't possible. The resources just were not there. And that's also really not the way it works in Canadian healthcare, is that it really is, like any system. There are ways that people can jump the queue and get special treatment, but there's a limit to that, and it's not as easy as people might think. And that was extremely hard to deal with. It made me feel very much like I had failed my relative. Because of the shortcomings and the gaps in the healthcare system. I don't know if anyone else has really felt that way, but I really felt it personally. But that's something I'm still kind of grappling with, is just struggling with the gaps that are there and knowing what an ideal situation could look like, and having to acknowledge that we're not able to meet that ideal situation. So that's hard, and I don't know if others would feel that way if they weren't in a medical profession, or if they would just feel like they would be more. What I encounter is that people have legitimate concerns about the gaps that they encounter in healthcare, and feel upset and angry about that, but they don't. I don't know if people would feel that responsibility. So that was one of the hardest things, and I'm still trying to figure out what to do about that. I'm open to suggestions if you have any, or if you've ever experienced that. The other thing that makes it difficult when you're a medical professional and your relative is sick is that I think we think about all of the situations that we've seen where things haven't gone well. We kind of know about all of the potential complications. and how serious they can be and how quickly things can change, and the limits that they can be reversed if they do happen. I know everybody has had friends and relatives who are sick, but they perhaps haven't seen like the hundreds and thousands of people that I've seen over my career. So, I've seen where things can change and go really badly. And so that's kind of what keeps me up at night, is just thinking about all of the potential complications and how, and there's no reason, just because my relative has a family member who's in healthcare, there's no reason why they shouldn't have complications. And oftentimes there's no right answer in medicine either. It's just balancing the risks of one action versus the benefits, and the risks and benefits of another action. So it's oftentimes choosing between different courses of action that can both have negative outcomes. It's easier to give that advice in a clinically distanced way. So it's easier for me to give that kind of advice to a patient. It's surprisingly different when it's your own relative. So even though we give advice to people, the best advice we can give, it's definitely not that we would ever give advice in a cavalier way. But I think when it's your own relative and just seeing the negative outcomes that can happen, when those decisions happen, there's so much more worry about, am I doing the right thing? Should we have done something different? Should we do something different? Looking back and saying, what if we had done this course of action before? That comes up in my clinical care of my patients, but I feel so much more responsible when it's my relative as well. That's really weighing on me, and I'm sure that it weighs on other medical professionals who are in that situation. I guess the final thing is that it's so draining to be a caregiver and to have a family member who's ill. And there are millions of Canadians who have family members who need a lot of time and attention and are struggling with a lot of medical and health issues. Working as a doctor can be draining as well. So it takes a lot of energy and compassion and attention to do work as a physician. As a geriatrician too, it's the care is very comprehensive and can be complex and can involve chronic disease management. So it's not usually that something is a short interaction where something gets fixed and gets better. Oftentimes it's a longer term interaction. It's harder to bring that level of compassion to work when there's a tax on it in another area. And in some ways, having a relative who's sick helps me to understand, I think, what the experience can be like for patients and families. But it leaves me with less energy for my work. And so the only way is to probably reduce the time that is spent at work in order to balance the energy that's going out in other places. And that's hard to do because the demand never really slacks off in medicine and in geriatrics. I just wanted to share some of those thoughts today. I think, again, there's lots of good things about being a medical professional when you have someone who's ill. There are a lot of advantages. And I really didn't want this to feel like a complaint about the experience that I've had with my relative, because the actual people providing the help has been exceptional and so positive and professional. And I think most of the challenges we've come up against are largely related to the system, which is harder to figure out where to lay blame or how to fix things. But nonetheless, it's difficult. So I do want to add that caveat that so many things have gone right with our medical experience, and I'm so grateful for the care that my relative has received and continues to get. And I've been so surprised and so touched by the level of help and communication and respect and compassion that I've had from my fellow doctors and from nurses and from clinical aides and paramedics and everybody who's been able to touch our lives lately. So I am very appreciative of that. I just wanted to share some of my thoughts about what surprised me along the way when it comes to being a doctor and having somebody who's sick in the family. As always, I'd love to hear your experience. If you work in healthcare and you've had a relative who's been ill, especially an older relative, let me know what that was like for you. And if you have any tips about how to navigate this, then I'm all ears. I'd also like to hear what else you'd like to see here on The Wrinkle. You can leave a comment below this video. You can go over to my website, thewrinkle.ca, where you can leave a comment, and you can also see all of my videos and articles that I've written. You can sign up for our newsletter there, and that way you're much less likely to miss a new video or a post. You can also follow me on Twitter and Facebook. I'm just so glad that you watched this video today, and I hope you'll come back again. Thanks for watching.